Welcome back, everyone. The author of The Purple World, Healing the Harm in American Healthcare, is now joining us live in the backyard. So let's welcome Dr. Jarvis. Let's get right to it, Dr. Jarvis. Why did you choose The Purple World for the title of your book?
Well, I was in my freshman medical class in microbiology. The professor was trying to impress on us about how dangerous the world was due to microbes. And so what he said repeatedly was, if urine were red and stool were blue, we'd live in a purple world. And of course, that was kind of a gross way of trying to explain to us that we need to keep our hands clean when we're taking care of our patients. I apply that concept of danger in the world to the healthcare system. When I say healing the harm in the American healthcare system, I'm referring to, for instance, patient injuries. 400,000 deaths a year in the United States due to preventable injury to hospitalized patients. That's where I got the name The Purple World.
Okay, let's talk more about that. So in the book, you talk about communicable disease outbreaks during your time in public health. So talk more about that.
Yes, I was the state health officer in the neighboring state of Nevada. Outbreaks of communicable disease are very common. They happen virtually monthly in a state the size of Nevada, and therefore what we're having today in the world with COVID is, although bigger than usual, it's not unexpected. We managed outbreaks of syphilis and hepatitis A, as well as other things, chronic diseases like suicides and asthma.
Tell us about one of the outbreaks you worked on as a public health officer. Go a little deeper for us there.
Well, that hepatitis A outbreak I referred to happened among state employees in Carson City, the capital of Nevada. It turned out that they were eating sandwiches out of vending machines that were stocked by a deli in Carson City that had totally lost control of its hygiene. There was no hand washing sink, and there happened to be one person who worked for the deli who got hepatitis A, which is passed in what's referred to as the fecal-oral fashion. Again, the purple world, as we talked about before. We discovered that the common link between all these cases of state employees around different office buildings was that deli, and we had to close it.
Now, you referenced this a little bit earlier, but let's talk about what can we be learning from your book and what we are all experiencing now with COVID-19?
Well, as I said, outbreaks are common. What we need is a public health system that's muscly, that's prepared, that's ready to deal with this. Unfortunately, and this is what we should learn, we have allowed our public health agencies to decline over the last 10 years. There's been a loss of 60,000 jobs in the public health sector in the United States over the last 10 years. We have got to beef up that thin blue line that's protecting us against diseases like COVID.
Okay, Dr. Jarvis, tell everybody, where can we pick up your book?
The book's available at thepurpleworld.com, where we're actually giving away a few copies if you go there, but you can find it wherever books are sold online.
Okay, Dr. Jarvis, thank you so much for joining us. We do appreciate having some of your time. All right, coming up.